The PRF is really exciting though, the platelet-rich fibrin injection. So we actually draw the patient's blood and we are injecting the growth factors into the jaw joints. So hello and welcome to the Move Room. My name is Kathryn Reber and I'm a doctor of physical therapy working out of Kinetic Physical Therapy in Westchester, Pennsylvania. This is our first time filming a podcast and we have awesome topics that we're going to be covering today. So we're going to be looking at the often overlooked connections between jaw pain, breathing, and sleeping. And we have an expert today with us to talk about some of that stuff. So we have Dr. Carly Jacobs, who went through an amazing career switch, primarily working in general dentistry as a dentist, and then making the career switch into focusing more on pain and sleep therapy. So now we have Dr. Carly Jacobs, who is out of the Pain and Sleep Therapy Center from the Mainline.
Yes.
So Dr. Jacobs, thank you for joining us on the Move Room.
Yeah, thank you for having me. I'm so excited.
Of course. So tell us a little bit about yourself. So how did you get into dentistry and where'd you grow up? All that stuff.
So I'm originally from St. Petersburg, Florida. And yes, why did I move here?
I was going to ask. Next question.
But so my mom was in the dental field. She was a dental assistant, then she was an office manager. So growing up, I was very involved in being at the dental office. I was never nervous to be at the dentist. I actually loved it. So it just felt very natural for me to want to move into like the dental world.
Amazing.
Yes.
And I saw you went to the University of Florida for your dental degree?
Yes. Yep.
Amazing.
And then after that, I did a residency at NYU for a couple years.
Very nice. So while you were in school, did anything hint at kind of where you would be today?
No, absolutely not. Yeah, this was, looking back, I would never even thought that this is where my career would have taken me.
That's amazing. Very cool. Okay. And tell us a little bit about that career pivot. So how long were you a dentist before you kind of made the switch?
Yeah. So I was working in general dentistry for about 5 years, and I was seeing a lot of patients that were suffering from TMJ issues, just a lot of pain, and really we're not taught in dental school how to handle these patients and what to do. Of course, making night guards is my go-to, but I really didn't understand what was happening, why someone was clenching and grinding, and I was just making these night guards, praying and hoping that they would work, and a lot of the times they did not.
Okay.
So really at that time, I would just send to an oral surgeon for surgery, but a lot of these patients, they don't need surgery.
Okay.
So,
gotcha. That's always good news for people to hear. A lot of people want to go the non-operative route.
Yes.
And especially for something like this, to know that there's all these resources, that's huge. Yes. And that's why a lot of people are going to be listening to this too.
Yeah.
So just to kind of give people a little bit of insight in terms of what is happening up here, like what's the TMJ, how does that affect the airway and everything like that?
Yeah, so I think it's important to, talk about airway and breathing because as you can imagine, breathing is the most important thing that we can do.
Sure.
And breathing properly is really important. So, we should always be breathing through our nose. Daytime and nighttime. The problem when someone isn't breathing well at night, so if I just give you an example, if you can't breathe through your nose, whether that's because you're just very congested, you have allergies, a deviated septum, well, what happens is then the mouth falls open and the tongue drops down and back. Okay. So the tongue then starts to narrow the airway. Your brain is going to recognize, well, there's an issue going on. So the body can use the lower jaw, the mandible, which is also part of the TMJ, and your body can then start clenching to help stabilize the lower jaw in order to keep the airway from collapsing. But then your body can also take the lower jaw and start moving it forward, kind of like CPR. You start to increase that airway space.
Interesting.
So that's really the connection with clenching, grinding, and the airway.
Okay, gotcha. So I think a lot of times when people think of the TMJ, they're like, oh, it's starting to click. And that's kind of like the only symptom that tends to pop into people's heads.
Yes.
Like it's a little achy around that area when I'm chewing.
Yes.
What other types of like common symptoms that you see that have to do primarily with the TMJ?
Yeah, so
like a disorder there.
Yeah, common symptoms, I would say, of course, the clicking and popping within the joints. A lot of people have, obviously the pain with chewing, or they're waking up with a lot of tension in their jaw, which tells us that they are definitely clenching and grinding at nighttime if they're waking up with that tension. And then not being able to open your mouth is, so these are all very common symptoms that people will really connect with the TMJ issue.
Okay. Because as a physical therapist, of course, we see a lot of people that have neck tension, headaches that kind of come up through the temporal region. Do you feel that some of that stuff is correlated with what's going on with the TMJ, whether it's a chicken or the egg type of situation?
Yeah. And I mean, in fact, if you look at the TMJ, the jaw doesn't work by itself, right? It's connected to the head, the neck. So if you have a lot of neck tension or poor posture, like forward head posture is a big thing, it can change the alignment of your jaw. And then that causes your jaw to function differently. So with my patients, I love collaborating with physical therapists because PT can really help with that muscular imbalance and help with the alignment.
Sure.
With that said, if you have a patient then that when they go to sleep, they start that clenching and grinding pattern, then they almost get stuck in this cycle where they feel really good after their therapy, but then they go to sleep, clench and grind, they wake up, they're in pain again. So that's where I think dentists and PTs can really come together.
Yeah, because from my perspective too, I mean, we see so many people that just in general, I think it's part of our society, you know, especially with the phones, the computers, we all tend to, I always tell people we look like cocktail shrimp. You know, we're kind of sitting there curled over our computers, what have you be. But, you know, a lot of times from what we can do, of course, we can start working on whether it's the stretching or the strengthening of all the muscles that kind of sit around this upper torso region. And what's great about that is, of course, you can start to alleviate the neck pain, the headaches, things like that, and sometimes some discomfort around this region. But I think what you just said is it's so important to know that there are, you know, other experts that you can reach out to start to kind of fill out those missing pieces. You know what I mean? Because frankly, I don't think there's one person that can typically do it all. Like it's nice to be able to kind of have that multifactorial and like treatment approach with it.
Yeah, absolutely.
It's really nice. I love it. So how do you think that, you know, if you have like poor breathing and stuff like that at night, you know, do you feel like a lot of people come into your office saying like, all right, I'm having fatigue the next day or just, you know, pain or like mood changes? Like, is that how you're seeing that quality of life being affected?
Yeah, absolutely. So when a patient comes to me for a TMJ issue where they're in pain, I'm going to ask about their sleep and how they're sleeping and how they're breathing. And a lot of people don't know that it's connected, right? Almost like, oh, wow, interesting. You're asking me about my sleep and breathing. And in fact, a lot of these patients that are in chronic pain, they're also feeling very fatigued. They're not sleeping well. So I always say, if I can help get you sleeping and breathing better at nighttime, then your body is actually going to start feeling better. Because if you're not sleeping, your body can't heal. Right? So
absolutely.
Yeah.
Let's get into a little bit more about clenching and breathing. So, you know, I think a common misconception, and tell me if I'm incorrect, but a lot of times people think that clenching is just directly correlated to only stress.
Right.
And are there other reasons why people will clench and like why that typically presents at nighttime?
Yeah, and there's many reasons why people will clench and grind, and clenching and grinding can become a habit, right? So, and it's interesting that you mentioned the stress component, because the amount of times that patients come to me and they've been suffering for years and they're like, if one more person tells me that I'm stressed, it's very frustrating because it's not helping them, right? It's just like, well, just go meditate or don't stress. However, if you're not breathing well at night, wouldn't you imagine your body is going to be stressed because you're not breathing? So a lot of these patients are just frustrated that that's what they've been told for so many years. And so for me, it's if even mouth breathing can cause your body to be stressed. So I'm very, very big on breaking the habit of mouth breathing, which is very rampant in our society from, you know, it starts in childhood, really.
Interesting.
So I'm very, very big on talking to all of my patients about not just breathing, but how to breathe properly.
Interesting. I can't tell you how many times, whether it's my patients or even family members that, you know, are taking videos of their significant others in bed and like, you know, they're whoever's next to them is waking up, choking, can't breathe. And they come tell me about it. And they're like, it's just because they're stressed or, you know, they're, you know, all these other things. And it's like, I don't know if that's true. So it's nice to talk to somebody who knows a little bit about this.
I would say if someone's gasping at night, they need to get an evaluation.
So tell us how you typically go through like the retraining of the breath, if that's even possible.
Absolutely. So at nighttime, of course, addressing how they're breathing at nighttime, whether a lot of my patients, I will get a home sleep test on them, because I definitely want to see, not just if you have sleep apnea or not. And I know sleep apnea is a very scary thing, and a lot of people don't really want to know, or they're like, I definitely don't have it. However, sleep apnea affects people differently. There are so many patients that I see that, they swear to me that they don't have an issue, they sleep fine. But I said, let's just get a sleep test. Let's just see let's just see the amount of times that the sleep test comes back, whether it's with a diagnosis of sleep apnea or something else. People are shocked. And at the end of it, they are very thankful that I'm looking at how they're breathing at nighttime, because we tend to wait until people are very symptomatic in order to then say, hey, you know what, maybe it is your sleep, where it's like, let's just be a little bit more proactive on looking at how someone's breathing at nighttime. Because if we're not addressing the nighttime breathing, it's going to be very difficult to change their breathing habits during the day. So definitely, I like to address what's happening at nighttime.
What is like the sleep testing? What does that look like?
Yeah, so the gold standard way to diagnose sleep apnea is, of course, in lab sleep studies. However, home sleep tests have come a long way, and they are really, really amazing, and people do better with a home sleep test. So there's many different types out there. I work with a lot of great sleep doctors that will send the test to my patient's house, and they take it one night, and it's very easy. I've taken over 5 different types myself, and I was able to sleep with them.
Interesting.
Even though I swore I wouldn't be able to. So
have you ever gone through issues with sleeping, and have you treated yourself?
I've treated myself for sleep.
Amazing.
Yes, I was a huge mouth breather. Not so much of a clencher grinder like pain, but I knew that my sleep was getting worse, and I did not have sleep apnea, but when I fixed my mouth breathing and I guided all of the air through my nose, it changed my quality of sleep tremendously.
So interesting.
Yeah.
Okay. There's a lot of different products I've been seeing come out, and we'll get into the different services that you offer, but I think my phone knew that I was getting prepared for this interview we were going to have, but I've been having things pop up on my, my Instagram feed, the mouth tape. I even saw something like a magnetic clip that went on the nostrils to open it up. What's your take on that stuff? I mean, does it work?
I love it. Yes, absolutely.
Awesome.
I do not recommend mouth tape without guidance, right? Because you have to make sure that you're not mouth taping someone who has underlying sleep apnea, or if they really struggle to breathe through their nose, you don't want to make things worse for them. But I do implement mouth tape throughout my treatment, it's amazing.
Is it just what it sounds like? Is there any like breathing hole at all, or is it just?
Yeah, so there's different types. The ones that I use does have a little hole in the middle, just because that people tend to like that better.
Yeah, I can imagine, or else you're kind of laying there.
Yeah, that was my favorite for myself.
So interesting. I want to know a little bit more about the tongue posture. And I don't know if this is a big thing that you talk to your clients about, but is there a correct way that we should be holding our tongue per se? I know you said typically when you're starting to have breathing issues at night, the tongue's kind of falling back in. So, are there, again, I'm sure we'll kind of talk about the different types of products that you offer, but talk to us a little bit about that.
So the tongue is my absolute favorite muscle in the body, because it can really affect not just your breathing and your sleep, but it can really affect the growth of your face.
Interesting.
There's a lot of great airway focused dentists out there. There's myofunctional therapy, which think of myofunctional therapy as PT for your tongue. So your tongue is a great muscle. It's strong, but it does need to be in your mouth properly. So the proper place where you should be resting your tongue is at the roof of your mouth.
Really?
So not just the tip of your tongue, but the entire tongue should be at the roof of your mouth.
Now I'm focusing so much about where my tongue is right now.
Yes, and I do implement exercises to help get the tongue more toned.
So interesting.
Yes, and get to the roof of your mouth. It's amazing because it really helps, with airway and with breathing.
Can you give us a couple examples of some exercises?
Yeah,
if people want to try it. Oh, really?
Yeah,
just like
tongue clicks are really great because it helps just strengthen up the tongue. But I have a lot of great fun tongue exercises that I can share.
Yeah, I have my 9-month-old baby at home working on his tongue.
Super important for kids too.
So you're really working on his
and I
tongue
can tell
posture.
you, as new and as silly it may sound to a lot of people, because my patients will laugh. They're like, "What are you talking about?" When I implement these exercises, they're like, "Oh my gosh!" Like, it's really helpful just from an overall even from a TMJ perspective, it helps get the facial muscles more balanced. It helps people to stay off of their teeth during the day. So a lot of people are walking around with their teeth in contact. And in fact, your teeth should only be touching around 12 minutes per day. Total.
Really?
Yep.
Wow.
Yeah. So when I tell that to my patients, they're like, oh my gosh, I walk around clenched all day. So these tongue exercises really help get people into I call it a healthy oral posture.
Okay.
Which
Very interesting.
is the tongue at the roof of your mouth, lips closed, and teeth apart.
Interesting. Okay. I know a lot of people are going to be at home working on keeping their tongue.
Yes. It's about awareness,
which is amazing. Right? Absolutely. Well, I think it's one of those things, just like breathing, where we're doing it subconsciously all day. You're not even thinking about it.
Absolutely.
But what's cool about it is that we do have the ability to kind of control it, influence it, and start to retrain it too.
Absolutely.
I'm a pelvic floor therapist as well, and we talk about breathing all the time. And one of the big things I tell my patients about is being able to retrain the breath when you're doing exercise or if you're just sitting around.
Absolutely.
Right? If there's something where you're holding a lot of tension in the pelvic floor, we talk about breathing and just letting things relax a little bit so that you're not constantly gripping, or just, implementing breathing into when you're doing day-to-day stuff like lifting groceries off the floor or exercising at the gym, running, things like that. And I think, about what you're talking about too, in terms of what's going on here, they're all connected.
Yes, absolutely.
It's amazing. Just when you start to put a little intention behind what you're doing day to day, it can really make a huge difference.
Absolutely.
It's so cool. So tell us a little bit more about the type of people that you see.
Yeah. So I have a lot of patients that come to me that they have been wearing and breaking night guards for years. But their pain has never really completely gone away, or it's getting worse. So these patients are just like, what can I do? Because this clenching and grinding, it's getting worse, and now I can't open, right? And then I have a lot of patients that come to me that they have a diagnosis of sleep apnea, but they can't use their CPAP.
Okay.
And a lot of the times it's not that patient specifically, it's their bed partner that's bringing them in because of the snoring, and it's secondhand sleep apnea, I like to call that. So the bed partner is really being affected by the sleep apnea.
They have the videos.
Yeah, it's usually the person with sleep apnea. If you ask them, how do you sleep? They're like, I sleep fine. I have no issue. But in fact, they stop breathing like sometimes 30 times an hour. So not everyone with sleep apnea will be symptomatic.
Sure.
So of course, I get these patients and I manage their obstructive sleep apnea with an oral appliance.
Very interesting.
Yeah.
Okay. Do you feel, is it more males, females? I mean, is there, or is it just kind of everybody?
Yeah, it's everybody. And I think traditionally the way to think of it is sleep apnea affects a certain body type, a certain age, a certain gender. That is absolutely not true. I see females, low BMIs that have sleep apnea.
Interesting.
And they're, unfortunately, those type of patients, the females, they are a little not ignored in that aspect, but no one's really looking at testing them for sleep apnea because they don't really fit that mold. So
like it's kind of what we were talking about earlier. It's, you think it's going to be the person that's super stressed at work. Somebody that's overweight that's having these issues, but it's nice to know, and nice to know for people out there that may be suffering with this, that you can be anybody and you could have this issue,
Anybody, yes.
And you kind of touched on this earlier as well, but does the breathing patterns or the tongue posture, is that something that begins pretty early in someone's life and then just kind of carries with them?
I mean, so when we talk about children, children can start mouth breathing because of, allergies, a lot of congestion in the nose, and then they start mouth breathing. And then the mouth breathing can affect how their face grows. So like I said, there's this whole movement just getting to kids early and teaching them proper habits on, how to breathe through your nose. And of course, identifying any triggers that are preventing them from breathing through their nose.
It even makes me wonder, like, just over the past hundreds of years, thousands of years, if the human face has drastically changed. I mean, I don't know, but I wonder if it has changed just because of what's in the air or whatever, and just how we
you nailed it, because
time.
We definitely have our facial development, our facial structures have gone smaller, and that it's a combination of environmental pollution, the foods that we're eating. So there's actually a great book by James Nestor called Breath. I do recommend recommend people read that book.
Okay.
It's amazing.
Okay. And they just kind of talk about that
They
stuff
talk
too?
about that. Yeah.
Okay.
And I do recommend it because a lot of my patients, they're kind of on this journey to just learn more about their health as well. Like they're ready to tackle this. So when I do recommend that book, it's amazing. Like everyone can benefit from reading this book.
Yeah. Very interesting. I have even just myself personally, I have some clients that have EDS or POTS, kind of those diagnoses that are a little bit more prevalent today. And a lot of times they do have issues with sleep. And, typically they're undergoing care through, just multiple different people. And sleep is kind of one of those things that sometimes is a little bit left out. And it's, they're typically told, oh, just make a good schedule, but good bedtime routine, and kind of a good luck with that, and they'll ask me, and I'm not well equipped to answer that question either. But do you see people with those types of diagnoses and, the services that you offer, do you feel like they are helpful?
Oh, absolutely. And of course, sleep hygiene is super important. Like that's a huge component of like what I talk about with my patients. But if there's a structural component going on, that also has to be addressed too.
Sure.
So, and I work with a lot of patients that have EDS as well, because as you know, they have a lot of TMJ issues.
Totally.
So they actually do very, very well in appliance therapy.
Sure. Okay. Very nice. Do you feel like there are a lot of conditions that are like misdiagnosed? Like, do you see people that have told you, like, listen, Dr. Jacobs, I've kind of gone through XYZ people and I don't know what's happening. Does that happen quite a bit?
Yeah, there's two symptoms that I see quite often. So headaches and ear pain, or ear symptoms, whether that's ear pain, ear ringing, or like congestion in the ear. The TMJ in the ear, they're like next door neighbors, right? So anatomically, they're very close together. So, they share nerves. So sometimes if that nerve is irritated from the joint, the brain can perceive that and get confused and almost think that it's coming from the ear, but in fact it's coming from the joint. Or there could be referred pain coming from the facial muscles due to that clenching, that grinding, that overactivation of the facial muscles. That can cause referred pain to the ear, as well as tooth pain. So I do have patients that come to me that they swear that it's their tooth that hurts. Their dentist identify that it's not the tooth. Then a lot of the time it's the referred pain from the facial muscles due to the clenching and grinding.
So interesting.
So that goes for headaches as well.
Okay. Yeah.
So when I come in there and if I could just shut down the facial muscles and just help, balance out the forces of the clenching at nighttime, it can really help just lower these symptoms.
Yeah. That's a huge, again, like light bulbs going off in my head of just even people I can think of that have that type of issue where, they have those types of symptoms and they're saying that they've tried the ENT, they've tried everybody. And
neurology as well.
I can't get there, like I don't know what's going on and they're suffering with it. But again, it's nice to know that you're right around the corner and you're able to do that. So let's talk a little bit more about your treatment approach. So like when somebody comes in the door, you said you do the sleep testing, and then where do you go from there?
Yeah. So when a patient comes, whether if they come for me with jaw pain, I screen them for airway. If someone comes to me with an airway problem, I look at their joints. So I look at comprehensively everything that's going on here. Our consultation could be up to 2 hours because it's a lot of gathering information. Like I said, the majority of my patients have been doing a lot throughout the years. So it's really unwinding, and is an appliance or an orthotic, would it be helpful and appropriate for their symptoms? And I do try to either get a sleep test prior to them coming in, or I will send them for a sleep test before I make a final treatment presentation, treatment plan for them.
Okay. So you mentioned orthotics. So what does that look like? Does somebody get fitted for an orthotic? Where does it go? What does it look like?
So there's a lot of different kinds. So sometimes I have to put someone in a daytime orthotic. Sometimes, a lot of the times a nighttime orthotic. But it depends on if there's an airway component going on or not. And they are different from night guards because the orthotic is putting the joints in a different position. It's helping to offload the forces to the muscles of the face. And the daytime orthotic can be very helpful with training people to not clench during the day. So sometimes I use it as a tool to help break that habit.
Okay, interesting. Once somebody starts to use that, how long does it typically take for the muscles around that region or the joints to kind of get into a place where they're breathing better? Like, how long does that typically range?
So it's so different for a lot of people. Some of my patients are in treatment with me up to a year a lot of the times, but they start seeing reduction in their pain, their symptoms pretty quickly, a lot of them. I would say within a month or so, we start seeing some changes. And changes in my book is good, whether they're good or bad. I know that sounds, people are like, oh, but I don't want to get worse. It's only short term. But like if there's a symptom that changes, even if it's for the worse, it means that there's a connection there. Right?
Something's happening.
There's something happening. There's movement. So I actually get excited about that. And then they slowly start to realize that connection. And then a lot of the symptoms will start to go down.
That's the same thing that can happen in physical therapy too. You know, I always educate people. Like a lot of these effects aren't immediate. You know, it takes like 4 to 6 weeks for muscles to just start to change in general. Whether they're going through a hypertrophy or a relaxation. And sometimes if it's more of a tension issue, that relaxation can kind of present as pain at first. You know, just because it's your body's new way of figuring out how do I still support and stabilize this region, whether it be around the jaw or any other joint around your body too. You know, so that's really interesting. So I know that you do some stuff like the Botox therapy, the PRF, I think it's called too, prolotherapy. Tell us a little bit about that stuff.
So Botox is never my first go-to. Botox is, it works for a lot of people. It really reduces the muscle activity, but a lot of my patients actually want to get off of using Botox because they've been doing it for many years because you have to keep getting it. So I really try to work on more like natural approaches on how I can calm the muscles down. And if I need to use Botox, I will, but just very short term. The PRF is really exciting though, the platelet-rich fibrin injection. So we actually draw the patient's blood and we are injecting the growth factors into the jaw joints. And so it's all natural. We're not adding any like anticoagulants or anything to the blood. So it is truly natural. And once we inject it into the jaw joint, it is slowly releasing healing properties over time. So our recommendation and the protocol that we use is an injection once a month. So 3 rounds once a month. And we are seeing really great healing in the jaw joints.
Is that a fairly new therapy?
It is, especially in the TMJ. So, but it's being used in so many different aspects of medicine right now.
Yeah, that's really interesting. What about things like, I think Snorlace is another thing that I've seen before. What is that?
So Snorlace is a treatment that I use in conjunction with oral appliance therapy for snoring. So when I'm treating someone for snoring or sleep apnea, I'm taking their lower jaw and I'm moving it into different positions to keep that airway open at nighttime. Sometimes there can still be some residual snoring coming from the soft palate. So the soft palate can become less toned. It can become more floppy over time. So the Snorlace is just a little bit of heat that helps tighten up the soft palate. It promotes collagen production. We're getting really good results with lowering that snoring even more.
So if that's kind of the heat aspect, I know you offer something like a cold laser therapy too. Is that kind of the opposite, or how does that help?
So that's different. So the laser that I use it's a class 4 laser. So it actually has 2 different wavelengths that work together that really gets deep into the muscle. So if you kind of think of, it's turning cells back on that have been injured. So it's really helping with reducing pain, inflammation, and it's actually causing the cells to repair.
Wow, amazing.
So we do that with almost everyone who is in treatment for TMJ issues.
Interesting. Now, is this something that you would be able to also find just like in a general dentistry practice, or because I know there's not many of you that are in the area that kind of offer these other therapies? I mean, definitely there's other dentists that are, definitely doing appliances for sleep apnea, snoring. There are a few other dentists that are in the area that I know of that are utilizing laser therapy for snoring and sleep apnea. But dentists definitely have a role in the airway world. And it seems like it's evolved a little bit.
It's evolved so much, and it just keeps evolving, and it's very exciting. But what's so unique about your practice is it seems that you kind of have the whole package all
together. And that's, again, there's so many people that are dealing with this type of stuff that if they kind of just need one place to go to, you're there. Which is amazing.
Yeah, we don't do any general dentistry, and I love collaborating with my dental colleagues. They're very excited about it as well.
That's awesome. Yeah. Okay. So you said typically, sometimes people can be with you for a year.
Yes.
Is that something that they're coming in weekly, monthly?
So it depends. At first, if someone's in like a lot of like pain, they are really limited opening, I do like to follow them very closely, at least for the first few months, because as they're healing and as their muscles are relaxing and their joints are, finding a better position, I have to adjust the orthotics, as these changes are happening.
Okay, interesting.
Once we have them to a point where they're feeling really good, then I can, not see them as often.
Okay.
But because, as you know, it's very multifactorial, the TMJ world. So many things like posture can cause symptoms. So I really like to monitor them and get them to a PT. I wish all of my patients, I could collaborate. Every single one of my patients would see a physical therapist, throughout treatment. Because remember, as their joints are finding a new position, what's happening with the body. Everything else is changing as well.
Yeah, well, I love that approach that you keep up with the patient and you will change the orthotic as needed to, because of course, that's the whole point of why they have the orthotic is to kind of change what's happening with the airway and what's happening around the TMJ. So it makes sense that their body is going to be changing too. And I think a patient would really appreciate that. I would if I was a client, to be able to make that change as needed. That's awesome. Are there any other like texts or like tech stuff or apps, things that you use in your business that people can utilize as well?
So I actually really love sleep trackers. There's so many different kinds out there. Fitbit, Apple Watch, the Oura Ring. I just think it's a really good tool for people to have, especially if they're really trying to change their sleeping habits. So I'm totally pro just those sleep trackers. If you want to see if you snore, or if you want to prove to your partner that they snore, there is an app called the Snore Lab app, and it will record your snoring and give you a number in the morning. And so I love this app because
That's awesome.
It definitely is interesting when people kind of do it on each other, like partners. But it's really helpful for me because as I'm opening up their airway using the appliance, if I see their snore number go down, then I know that their airway is open at nighttime.
Interesting.
So
that's so fascinating. I want to meet the guy or the girl that made that app. That's awesome. Too. Very cool. Okay. Yeah, I have the Oura Ring, and I think it was so fascinating just to see. I have no idea how it's tracking it. I just totally believe it, whatever it's telling me. But I just think it's so fascinating how it's taking your heart rate and even just all the measurements for the breathing to kind of tell you when you've been waking up and stuff like that.
Absolutely.
And whether it's because of my brand new baby or maybe not breathing properly, but I wake up quite a bit. So I may need your number. So. That's amazing. So
I do like to mention though that these sleep trackers are not diagnostic. So you would need a sleep test if you really want to see if there's like sleep apnea or other kind of like diagnosis going on. Because I know a lot of people will use these sleep trackers to identify that. But
what's your one piece of advice? Like if somebody's listening right now and they're kind of like, oh, I might have jaw pain, or I don't know if I'm sleeping well because of all this. Whether it's their first step in terms of recovery or just things that they can start to do at home in the meantime until they find you. What's your one piece of advice for them?
I would just say advocate for yourself. If you feel like something is wrong and doesn't make sense to you, especially when it comes to your sleep, don't wait until someone recommends like a sleep test. Just ask for one. They're so easy to get. And then also, if you have sleep apnea and you can't tolerate a CPAP, there are other options, whether it's an appliance or there's Inspire. So I say that because there's a lot of people out there that are living with sleep apnea that's not being treated because a CPAP is wonderful. It works 100% of the time, but you have to wear it. And a lot of people can't for so many different reasons. So they just choose like not to treat it. But unfortunately, what I see in my practice is that patients were never told that there was another option to treat their sleep apnea, and it's a very serious diagnosis.
Absolutely. Okay. Where can people find you if they want to get ahead of this?
Yeah, well, today I'm here. You can find me at Pain and Sleep Therapy Center in Bryn Mawr, and we set up the office where we do free 30-minute virtual consultations so they can, learn more about our practice, just gather more information, and then from there we will book in-person appointments.
Okay.
Yeah.
Awesome.
Yeah.
Thank you.
You're welcome.
Thank you, Dr. Jacobs.
Of course.
This was amazing.
Yeah.
I learned a ton about what you do.
Good.
And again, even as a physical therapist and PTs listening out there as well, it's nice to know that you're in the greater Philadelphia area as someone to refer clients to.
Absolutely.
And if you are somebody that struggles with sleep apnea or TMJ pain, also another great source to be able to go to.
Yeah.
But thank you so much.
You're welcome.
Keep learning, keep moving, and we'll see you next time.